February just days away now, and it is also Heart Month, and Intermountain Health's Dr. Liz Joy is joining us in this sponsored interview to talk about women's heart health. Welcome back to the show.
Yeah, thank you.
So heart disease still the #1 killer of both men and women in the United States. Are we getting our checkups? Are we monitoring our health as much as we should be?
Probably not. I mean, there's just so many different risk factors for heart disease, such as high blood pressure, high cholesterol, overweight and obesity, insufficient physical activity. You know, those are rampant in our society.
Are we thinking about this as young as we should be?
Absolutely not. You know, heart disease prevention starts early, and it must, because even in their 20s, you know, around 6% of women already have some evidence of heart disease.
Even in your 20s?
Even in your 20s.
That is so young. Talk about Intermountain Live Well Center. How do you get the education and tools there that you need to be heart healthy?
We have 5 Live Well centers at Intermountain Healthcare. We have one in Ogden, in Salt Lake, in Utah Valley, Park City, and down in St. George. And within the Live Well centers, we have providers who can perform a comprehensive physical examination. We have registered dietitian nutritionists who can provide medical nutrition therapy and give people a personalized nutrition plan to help protect their heart, along with, you know, prevention of other conditions. And we have exercise physiologists who can assess your fitness level and provide a personalized exercise plan.
So anyone can go there and say, I'm worried about my heart health. What can I do? And they'll do a personal assessment.
Yes, we call it a lifestyle assessment, and they'll come in and they will have an evaluation by all of those professionals.
All right, well, we have help for you today, though, everyone, and tips and tricks that you can start protecting your heart and making sure it's healthy. The first one you say is exercise.
That's right. Well, and let's just call it physical activity.
Okay.
Really, because, you know, it's the whole physical activity continuum. We want people to move more and sit less. So I don't know, maybe we could stand up, right? But you do a lot of standing here. That's good. But we want people to do active transportation. You know, walk to the coffee shop, walk to visit your neighbor, get in your car less, do some gardening in the summer, shovel your snow in the winter. People oftentimes jump straight to exercise. And exercise is great. I did some this morning. But, you know, in order to be physically active, it doesn't require you to put on Lycra and go to a gym.
I like that you said that, because I think oftentimes you're overwhelmed with exercise and how much I have to do that word each day.
Absolutely. And, you know, the physical activity guidelines for Americans do recommend that people get 150 minutes a week of moderate intensity activity, like a brisk walk, plus 2 sessions a week of muscle strength training. And that could be done at home as well. I mean, there are apps that don't require you to use any exercise equipment at all.
The next one is eat a healthy diet.
Yes, I'm a big fan of the plate. And the plate says that, you know, half of your plate, if you look at a typical dinner plate, half of your plate should be fruits and vegetables, a quarter should be lean protein, like fish or chicken or other lean meats, and then a quarter of your plate should be whole grains.
So if it's a burger and it's taken up the whole plate,
yeah,
we've got to do some adjusting.
Probably
right there.
not the healthiest choice.
Let's talk sleep. Are we getting enough?
No, I mean, I think all of us, you know, and it starts with our children, right? We want our kids to get enough sleep, but adults actually need 7 to 9 hours of sleep a night. So, you know, think of your own sleep schedule.
Right, yeah, what did we get over the weekend? Maybe not enough. Manage stress.
Yes, so important. I think, you know, our lifestyles are often infused with stress. Things like yoga, and I have developed a yoga practice. Every Friday morning, I do yoga.
Have you noticed a difference?
Yes, absolutely. I'm a complete devotee. And I just find that it just centers me and just prepares me to kind of finish my week.
All right, also avoid unhealthy substances. And I want to get to this last one, maintain strong social connections. That's so important.
It is. And it's important for both men and women. But I think people find it interesting, right, that social connectedness is an important risk factor in terms of addressing that when it comes to heart health.
Yeah, make a call.
Yeah.
Say hi to someone. Text them. Connect.
Absolutely.
If people would like to go to Intermountain Live Well Centers, what should they do? Stop by?
Yeah, you can just give us a call at our Live Well Centers. I think the phone number is available.
It is. We're making it easy. It's on your screen, everybody.
Yeah.
385-282-2700. And you can go to our website for more. Thank you to Intermountain Health for this sponsored segment headed into February and Heart Health Month. We appreciate you being